This evening is for the attention of the Minister for Health, and it's in relation to Albury Wodonga Health. Last week I was in Wodonga and met with the member for Benambra, my colleague, Mr Tilley, who was giving me an overview of the many concerns that he has been hearing in his office, but also raising in the Parliament. We met with health officials and we met with board members of Albury Wodonga Health who were very concerned about the status of the service, and in particular the lack of perceived interest by the Andrews Labor government. Mr Tilley has approached the Minister on a number of occasions and asked him to visit and come up there and see just how dire the situation on this very important health service on the border actually is, and the enormous pressures and strains that it's under. Albury Wodonga Health, as we know, is an agreement between both the New South Wales and Victorian governments. The intergovernmental agreement has not been signed and is lying in limbo, has been lying in limbo for years. 2017, years overdue. The health service employs more than 2,000 people. Their future is also in limbo. Many people, as I've said, believe this government has given up on Albury Wodonga Health. The talks of mergers that have been raised by Mr Tilley, deafness, silence from the government, no answers. Yet there is discussion about mergers, but importantly, master plans that have not been released, $30 million provided by the New South Wales government that's sitting in the Victorian Government coffers, not spent, so that was meant to be spent on upgrading the emergency department. Well, this week, Albury Wodonga Health went into a code yellow because of the huge stresses on that health service. On Tuesday, after I left, it went into code yellow. The emergency department clearly needs help. The health service needs help. It is not meeting the needs of that growing community. Where is that money, Minister, that you are sitting on? Why hasn't this important piece of infrastructure started? On Boxing Day a couple of years ago, there was a record number in ED, but that has been eclipsed 3 times in the past month alone. These are very, very serious concerns, and doctors are saying that people's lives are being put at risk. We're seeing that with what happened this week. So the action I seek is for the Minister to, as a matter of urgency, to understand the very, very critical needs of this health service and to get up there with Mr Tilley, speak to the board members, speak to those frontline healthcare workers, doctors, nurses, pathologists, pharmacists, physiotherapists, everyone involved that runs that magnificent health service, to give them the support and that they desperately need.